Parkridge Valley Hospital is a place where you make a difference in other people's lives.
They're coming in crisis, so they're afraid, sometimes paranoid, sometimes they got other things physically having issues, and they just need to know that somebody cares. And so we're at this part where it is so important as they're coming through that crisis to be able to work with them, get them to look at their issues, because sometimes they don't know that they have those particular issues, and also to be able to point them in a direction that they'll continue to work on.
The Parkridge Valley Behavioral Healthcare System is comprised of hospitals and outpatient facilities located across 70 miles in southeast Tennessee and anchored in Chattanooga. And our footprint across the region is substantially larger as we provide behavioral treatment and services for individuals from 4 years old through the lifespan. Every day, our providers come to work knowing they have the opportunity to instill hope in patients who are experiencing the darkest times of their lives.
The skills that I'm teaching them are, like the coping skills, the vending skills, the how to be able to manage their depression, how to be able to manage their anxiety.
So to see our facility give resources to teach them positive coping skills, to even give them alternatives to what their lifestyle is right now, and that changes not just at the moment, but changes their lives completely. That's the gift.
I think it's tremendous gratification, being able to impact the lives how we do here, helping the kids. We help them come up with daily goals, also short-term goals and also long-term goals to help them achieve, the things that they haven't been achieving in the past.
It makes me feel good to know that me putting pride in the food that I cook has sometimes a huge impact on the patients that we serve. You'd be surprised at how many people come in that haven't eaten all day, and when they come in and get a hot meal, it makes them feel good.
We spend a lot of time with them, making sure that they're listened to, I guess. We're kind of like the front line. We work closely with the nurses, and I love it.
I've always wanted to help others and make a difference, and every one of these patients that walk through that door make a difference in my life, and they touch my life in a way they'll probably never understand. And I just hope that every day and every interaction I have with each of them that I can make that kind of difference in theirs, because it changes me for the better, and I just hope that I can do the same for each one of them.
This is probably one of the best places for respect and camaraderie between the different disciplines of staff. You have nurse techs, you have cafeteria staff, you have pharmacy, you have nursing, physicians, case managers. Everyone gets along really well, but I think the biggest thing is that we have the most common goal together is the patient.
I use activity from using arts and crafts, games, sports, music, just to kind of help them find positive coping skills and outlets to find better choices to do in their environment.
I get the opportunity to really see the kids that are in need from the community, kids that are looking for a place to get treatment. And I get the opportunity to review a lot of their files, talk to parents, talk to families, and to kind of help kids get in so that they can find the right kind of treatment, the sort of stuff that works best for them.
We interact and we get to talk to them and let them vent, and we are able to transfer some messages to doctors so that they can appropriately diagnose and write medications for the patients.
The pharmacist staff here, myself and others that work at the Valley campuses, we interact with the nurses. We interact with the physicians. So we're able to make recommendations, we're able to protect the patient. I think that being able to be a part of that and see the patient come out well on the other end gives us a great sense of satisfaction.
And they leave with a different perspective. And they leave with some hope, that they can succeed, that they can be something, they can live. Yeah.
We're kind of seeing them grow and build trust with other people. That means a whole lot.
You feel this difference from the kids that you give the information to, and you feel like that when you leave every single day, it's not just a job, it's more of a difference making in what you do.
I would encourage anybody who is looking for a challenge, looking for something that's eclectic, that's a variety of skill set use, that wants to help people, come to Parkridge Valley Hospital.
If you do get the opportunity to work at Valley, you're working with a family.
The culture here is an honest, responsible, family-type culture.
We absolutely love having new members come and join our family, and we all add something new to the table here that helps make a huge difference every day.
These last 11 months has been actually some of the best months that I've had in my work career, so definitely give it a try.
It's a place where you can fit in, plug in, become part of a team, part of a hospital, part of a community that has as its sole purpose to improve the lives of those around us.
It's a smaller hospital, so you are going to get support, and we don't just support you in the field that you want to learn, but support you in advancing in your skill and your profession, but that we support you as a person and your level of skill. And so I think this hospital is wonderful in supporting you both here, outside of here. We become a family. So it isn't just coming to work. We are supporting you inside and out of this hospital. So that's what I love about working here.
Living in Chattanooga gives you the opportunity to take advantage of the wide range of outdoor activities and cultural opportunities offered throughout the area. Whatever your interests, there is always something exciting to do. Working at Parkridge Valley provides the opportunity for individuals who are passionate about behavioral health care to work in every aspect of the discipline and with patients of all ages. On a larger scale, we are part of Parkridge Health System, which allows us to interact with and support patients throughout the Parkridge family of hospitals, whether that be in one of the emergency departments or through inpatient and outpatient services at multiple facilities. Such an expansive scope of care is hard to find elsewhere. On an even larger scale, HCA, one of the largest healthcare systems in the United States, is the parent company of Parkridge Health System. This offers virtually limitless career opportunities throughout the country and abroad. We are looking for behavioral healthcare providers who want the opportunity to be the difference in people's lives. If you are looking for a life-changing experience, look no further than Parkridge Valley.